MCQ of the day, episode 9. Today's MCQ is not just important for exams, but it is going to test your decision making skills in the golden hour when the patient is critical. So let's dive in. Let's see what is the MCQ. And the MCQ says that he is a 65-year-old man and who is having poorly controlled type 2 diabetes mellitus. Okay, poorly controlled type 2 diabetes mellitus is there. Right upper quadrant pain, fever, vomiting. And right upper quadrant pain, fever, vomiting. He has tachycardia and hypotension. So BP 82/48 means he is going into shock. Okay, so this person is going into shock, and even his WBCs are elevated, and the lactate, if you see, the lactate also is elevated. So this means that it is a sepsis, because here he is showing that he is having fever, he is going into shock. uh, so see, there is fever, there is going into shock, elevated lactate, elevated WBC. All of these is pointing towards sepsis. Now, if you see the bilirubin, okay, bilirubin is slightly elevated. CT scan. So CT scan shows gas within the gallbladder wall. ये important है. What's important is that there is gas within the gallbladder wall, not within the lumen. It's within the wall of the gallbladder. See, if this is the gallbladder and this is the wall of the gallbladder, and he is saying that if this is I am drawing gas with blue color, so there is gas within the wall of the gallbladder, okay, not in the lumen, in the wall of the gallbladder. And no biliary duct dilation or stones. Okay, so no obstruction is there, no obstruction is there, just the only positive finding we have is gas within the gallbladder wall. Okay, what is the urgent intervention? Now first let's understand this condition. See, in your entire undergraduate surgery syllabus, gas within the gallbladder wall is coming only under one topic, and that topic is emphysematous cholecystitis. And emphysematous cholecystitis, it usually happens in diabetic males, not males but diabetics. ठीक है, old diabetic, obese, who are not having their diabetes under control, they get this condition, and it is caused by gas producing bacteria, and like clostridium. ठीक है, so and this causes in a severe inflammation of the gallbladder with production of gas within the gallbladder wall. This can be very dangerous. The patient can go into sepsis, and there is high mortality if you don't treat in time. Now we'll look into the options. We'll see what are the interventions that he is saying. Uh, First is give IV fluids, no problem with IV fluids. Give antibiotics, ठीक है, no problem with antibiotics. Scheduled cholecystectomy, perfect. But he is saying that for tomorrow, ठीक है, till tomorrow the patient may die. ठीक है, so you have to do autopsy by tomorrow, not a cholecystectomy. So this I have objection with this word tomorrow. So if you read it superficially, you may take actually this answer, but this is not the answer. See, immediate percutaneous cholecystectomy tube. This seems to be more logical one, because what we'll do is to control sepsis, we'll first attack the source of the sepsis, which is the gallbladder, and will create an opening that will relieve the ongoing inflammation and ongoing this thing which is leading to sepsis. So we'll attack the source of the sepsis by creating a tube and connecting it to the exteriors. Okay, so this seems to be much more logical. Urgent ERCP to rule out choledocholithiasis. Choledocholithiasis, what is that? It is stones. So stones, no, there is no need for stones. ठीक है ना, no suspicion of stones. CT scan में stone नहीं है, and we do not need to do ERCP. ठीक है, it is just wasting time. And when we have got such a good positive finding, we will just be wasting time by doing ERCP. And third option is start antibiotics, no problem with antibiotics, do a HIDA scan. See, again, we have already done the diagnostic scan, no need to do confirmatory scans again and again. When do we do a HIDA scan? We do a HIDA scan when we are suspecting cholecystitis and the ultrasound is normal, or we are suspecting acalculous cholecystitis. Other than that, there is no need over here to go do an HIDA scan, since already the diagnosis has been done by CT. We have got such a good positive finding. So here you can save the life of the patient by putting a cholecystectomy tube placement immediate. So this seems to be the most logical of all the four options. And this was our video on today's MCQ of the day. If you want a further discussion on topic of biliary system, I have made an entire video, 1.5 hour long video explaining the entire biliary system from the anatomy all the way to the surgery. You can see that video as well. Alright, this is me signing off. Keep watching this series and see the other videos of this series as well.